continuing with us as we are in our Ebenezer Praise Time chat room. I want to say welcome to the two doctors who are in the house, and I will ask Nina, she has become a part of this team now, to introduce our special doctor. Go ahead, Nina.
Good morning, everyone, once again. It's a pleasure being here, and with me I have a very special guest. I have Dr. Yaquelin Gonzalez Ricardo. She is an endocrinologist and a diabetologist that's working at the GPHC hospital, where she has her own department and she deals with mostly some of the endocrine diseases, mainly the one we're talking about today, diabetes, and there's some others too that we will see her talking about later on. And it was a pleasure and an honor for me to introduce to you once again Dr. Yaquelin.
Thank you, Nina, for this nice introduction. Well, we try to do our best today. Talking about this illness that is really an important disease all over the world.
Yes.
Then we'll try to do our best effort, huh?
Yes.
Okay, well, as I told you before, diabetes is a serious illness. Diabetic is all over the world. The number of the cases of diabetic all the time are increasing. For example, before it was just as a small concept. There was a disorder that called that the person have hyperglycemia because of the lack of insulin. But now everybody knows and the concept changed. That is a metabolic syndrome. It's a big metabolic, it's a big sack of disease that conform metabolic syndrome that they all have in common that they have hyperglycemia and they have a total lack or partial lack or the action of the insulin, which is one important hormone for the function of the body. Okay, that's why all over the world the diabetes is an epidemic. Everybody knows that it's an epidemic. They ran in 2000, for example, it was about one number, and now it's 4 or 5 times the million of people that have the diabetes. But the thing is that in Guyana, we have some reports, but still we don't know exactly the number. For example, we made some outreach last in 2016, 2017, and we found a lot of patients that passed for the outreach. When they check it, they are diabetic, and they are walking and they don't know. Then, so for example, in Guyana, in 2018, when they do a report for the health, the first cause of death in Guyana was coronary heart disease. The second was a stroke, and diabetic mellitus have the three place. After that, prostatic cancer, and after that, hypertension. But something important is that diabetes is a direct cause of the first and the second. This means most of the patients with coronary heart disease and most of the patients with hypertension, most of the patients with kidney failure are diabetic. Then, and the recommend for me, it's not because it's my specialty, but for me, one of the most important cause of death is not the first, is not the second, but this is very important, is the diabetes. Then, example of that is that for last year in Chronic, they do a report and say that out of 64 countries, Guyana is the number 1 and Trinidad is the number 2. It means most of the people during the world of life, they don't know that they are diabetic. I mean, they do the diagnosis, they have complications, and they have to lose a lot of years of healthy days, of healthy lifestyle, because they don't know they are diabetic. When they come to diagnosis, of course they have a complication. According to editorial in Time, last year they say that Guyana has 61,000, more than 61,000 cases of diabetes. It means that it's a little over 14.3% of the population of Guyana is diabetic. That's the only. This is a study of a piece. We know that is a lot of people that are diabetic and we don't know diagnosis. It means that it's maybe near 60, maybe near 60. We don't know exactly the number, and that's very important. Well, the clinical picture of the diagnosis of diabetic is very complex because, for example, the people have thirst, the people have weight loss, the people have blurry vision, the people are increasing the hungry. There's a lot of things that show that you are having it. And there is some common symptoms that other illness that the people confuse. Yes. That's why it's important, the checkup. Important to check. For example, the people start to contaminate to urine, extreme hunger, unexplained weight loss, fatigue, irritability, urinary tract infection, blurry vision, even some access in any part of the body. But as I told you before, in a lot of people, they don't have no symptoms.
No.
And that's the big problem. For example, in type 1 diabetes, when they stop function the pancreas and you have complete deficit of insulin, well, it's easy. But the other type 2, they start to have a lack of insulin slowly, and then you don't feel that you have something. And then you walk, till you have a complication.
Okay, Dr. Jacqueline, I have a question. So you made mention just now about type 1 and type 2. So there are other types of diabetes?
Yes, of course. When I was medical student some years back, they say type 1, type 2. But right now, we know that it's type 1, which is a total lack of insulin. You see the pancreas don't produce more. The type 2, which is the main cause, is the insulin resistance of the decrease of the action of the insulin. And type 3C, which is a new thing, and there is other gestational diabetic, which is appeared during the pregnancy. The other number of the other diabetic is other kind of diabetic, which is other metabolic disease that come with problem in the level of glycemia, like Cushing, like acromegaly, like Tutusin. And right now, there are some research about one special type 3C. The people is treating the case like type 2 and they don't reach the control. And when we review is a type 1 diagnosed as a type 3, as a type, then it's a very complex thing. Okay. That's why it's complex. But the most important is to try. In Guyana, it's a little difficult to put the patient in a place because for that we need some antibody. We have to do a special training that is not still we have not available. We hope in the future we are. But at least if we know that the patient has diabetic, well, proceed for the treatment, proceed for the care of the patient, and then avoid the complications.
Okay, that's great. Another question I have for you is as it relates to the criteria or how can a person identify what are the things that they can say, will make them think that they should go for a checkup for diabetes?
Well, that's a very important question, Nina. Because there is an international criteria written by the American Association of Clinical Endocrinologists, where we are part of this association, and the Endocrine Society and the Diabetic Association for the Caribbean region. Let's say, for example, if you have the age over 45, if you have a family history of diabetic, if you have cardiac problem, if you have overweight, if you have sedentary lifestyle, if you have dyslipidemia, cholesterol high, and so, if you have, for example, one of the complex syndrome we're calling now, like polycystic ovarian syndrome, if you have too much hypertension, history of gestational diabetes, you must be checked. You must be checked because you are in risk of have that. Okay. This is one thing. The second thing is that a part of this criteria, you must be careful about because, for example, if you are taking medication that can rise up the sugar, also you have to check because you can have a transitory or permanent diabetic. For example, if the people have asthma, if the people have arthritis, if the sugar will be high, they will have to be clear about what happened there. And that's very important. Okay. And for example, it's very important the diagnosis, the criteria of diagnosis. For example, there is something called pre-diabetic. The pre-diabetic, me as a doctor, I would like to take all the people as a pre-diabetic because if I know that you are pre-diabetic, I can worry them. I can advise. I can take some measures, take some provision and help you, and you come back, which is good. Yeah. If you are pre-diabetic, you have like knock the door for go to diabetic, and I know that you are like that, I can treat you, and the first thing you can prevent it, and that's very important. It means that, for example, if you have the blood sugar less than 100 milligrams per deciliter, you are normal. But if you are between 100 and 125, then you are in risk. And if that is fasting, and if you are over 126, you are already diabetic. This is fasting. Then 2 hours after it is normal is less than 140 milligrams per deciliter. Then over 140 till 199, you are a risk. And after 200, then you are already diabetic. For me, I would like to catch the people at that time. Yeah. But all over the world, there is other criteria. It means that if you have symptoms, you have to do the test. Then HbA1c is other test that now they have to do advanced because you can do without the fasting because you have different. But then situation that the HbA1c no work. Then we have to continue doing the fasting and the tolerance test. Okay, these both are.
So what you're saying to me is that it's important for us to do some screening, some testing, right? So you mentioned that we can do the fasting blood sugar, that's one, and we do the fasting 2 hours after that, after meals, and also there's a new one, which is the HbA1c as well for us to do. Okay, so what are some of them? You just identified the criteria, you identified whether you're pre-diabetic and diabetic and how best you'd like to see them. What else would you like to share with us?
About what? What do you want to say?
As we move on, the complications, that's the most important part.
Okay. One of the most important things about diabetes is when you take the person with pre-diabetes, you can avoid a lot of things. For example, the complications. The chronic complication and the acute complication. Among the chronic complications, we have the stroke, we have the heart attack, we have peripheral artery disease, we have the glaucoma, we have diabetic foot, cataract, all these things. That's why I tell you that if the stroke and the heart attack and the neuropathy are complicated for the diabetic, then diabetes will be the first cause of dying, Diana. It's just like, it's just because there are complications. And something important, for example, from 1 to 5 patients in the moment of diagnosis, they can have 2 chronic complications with the diabetes, retinopathy and nephropathy. And the leading cause of blindness and renal disease is diabetes.
Okay, very interesting. So, if you didn't get that last piece, let me repeat it for you. The leading cause of blindness in most Guyanese people is directly or indirectly related to diabetes. The person may have had a history of diabetes before. Stroke also, they may have a history of diabetes and also hypertension. The person may have an underlying history of diabetes. Yeah, so tell us more about the eye conditions as it relates to diabetes.
Well, as I told you, the complication of the diabetes can be chronic or can be acute. The most, from the acute, the more dangerous for the people are hypoglycemia, which is very low sugar, and hyperglycemia, which is very high. And both are, this jumping on the blood sugar is the one who causes the complication, the chronic complication. For example, between the chronic complication, as you told you before, and the acute things are good. But the chronic is neuropathy, nephropathy, retinopathy, all the answers. Then acute, hypo, and the people, they have hyperglycemia, it's very dangerous because after that they can develop acidosis, diabetic ketoacidosis, hyperosmolar coma, and a lot of bad things that we can prevent if we know they're diabetic, if we know that we can treat the people. Okay? For example, it's very important that people keep checking if you have dry skin, if you have blurry vision, if you have chemotherapy, all this can give you a diagnosis of diabetes and give you that you are too high, the sugar is too high. Okay. Then as you see, the diabetic is very complex. We have to, one important thing that we have to check in the diabetic is, for example, when the person is diabetic, has a lot of worry. They say, you do diagnosis of diabetes and the patient and the stress, and you are stressed. They say, why to don't have the blood sugar low is important? Why my therapy fail? Why I have to use insulin? Why, one important thing, why if I don't have symptoms, why I have to be treated? That's a type 2 diabetes. Most of the time we have to convince them because they say, no, I don't have symptoms. Why should I be treated? Should I be afraid of using insulin? So in the 2 years I've been working in this country, I find a lot of patients with some mistakes or some bad news about the diabetes. Why is it bad news? They say, Doc, if I use insulin, I will become blind. Doc, if I have used metformin, I will become sexually functional. Doc, what happens with if I don't use the medication and I can use natural home, I say, well, you can use these things, great things. I'm not against that, but please don't stop the medication because that's very important. No? And you can become blind if you don't care properly. But if you care properly, you can spend all your life without it.
So as it relates to the management of it or the care, what would happen if a patient refuses to take medication?
Well, it's complex if you refuse to take it. This is a problem, let me tell you, this is something important, like you do, like a good relation between the person. In church, it should be a good relation between the doctor and the patient. We have to make a deal. We have to try to convince the patient should be feel comfortable with you, like your family, like, you know, and you can explain them because it should be equipment.
Okay, so you think it's a one-person kind of thing, or it's a team effort?
No, it should be a team. It should be dietitian, to be a nurse, to be a family, to be everybody. To be a diabetologist, to be a care professional, to be a specialist, everybody. It's a team. It's a one for everybody. Okay, it's a team.
Yeah, so Dr. Jacqueline, as Dr. Holder said, that we are running out of time. But I still want to go back to two questions. First one, how easy it is for patients to get the hemoglobin HB1C, and this whole aspect of libido, especially in male patients. What do you want to tell our viewers?
Well, that's a very important question, both. One, I will start from the back. Well, then this is one of my weapons, my special weapon to the men. When I do diagnosis with a male after diabetic, I talk clear with them. And I say, well, I can promise you, if you follow my instruction, you will be okay. Yeah. But if you don't be okay, well, you will damage the relation with your wife because, you know, the libido can decrease. Then you can lose the potency, sexual potency. Then don't do for your wife. And the second thing is that the HB1C, well, it's available in Boston. I think in private hospital it's available also. And I think some health center, I'm not sure it's one health center, but I know there is a project, Kayana Care project, diabetic project, that they have put some money and some efforts, and that most of the people can have this. It's a project, important project about that includes testing retinopathy, includes diabetic, gestational diabetic, and other things. This is one of the things. I think it's available in Boston, it's available.
Okay.
It's available.
Okay, so what are some final words? Because next week we'll come again, but what do you want to leave with our viewers?
Well, I would like that the people ask of himself about the doubt, about the question they would like to re-answer, and then the program will be more important, because it's not just we talking about that, it's just that the people want to know, because diabetic is an important issue. We need maybe, I don't know how many months we will need to talk about the diabetes. It's a big topic. But we can help the people if the people ask the question that they want to know. Maybe we help the people more easily in this way. Okay? But for me, if the people take care, they will be okay. It's just don't live for the diabetic, it's just live with diabetic and take care of it. That's it. That's it.
Okay, so thank you very much, and I think it was a pleasure having both of you here on this program, and I'm elated that you have said so much. I think there is much more to be said, and I hope our viewers will be stimulated and that they will find a way to ask questions. The numbers on the screen. Ask your question, I'll write it down, and next week when we come back, we start off with some questions, and then we go ahead with our topic. Until next week, God bless you. Bye-bye.